I'm Heather Della Fuente. I am a clinical psychologist here with Swedish Medical Group, and I'm also the medical director of the Behavioral Health Integration Training Program. Our Postdoctoral Psychology Fellowship Program is a structured one-year program for psychologists that have recently earned their doctorate in clinical psychology and are seeking to expand their training in integrated primary care settings. The primary care behavioral health model is a model of integrated care where we have behavioral health providers that are embedded within integrated primary care settings. And it's really aimed at partnering with the primary care physicians and the primary care team to improve the health outcomes of our patients. Too many people in Washington still go without mental health care, yet they continue to receive care in their primary care provider's office. The barriers to care are cost, complexity of navigating the mental health system, the time to access mental health care, and the stigma that exists towards mental health. By being in an integrated primary care setting, we're able to normalize that, and we're able to provide support in a time when somebody's vulnerable and asking for help. And by doing that, we're destigmatizing mental health, and we're letting patients know that it's okay to ask for help, and help does exist. One patient that comes to mind is an adolescent male who came to his primary care provider for his annual wellness visit. And in that visit, the primary care provider was picking up that this patient wasn't as engaged, they were experiencing some irritability, there was a drop in their grades, but they were struggling to engage the patient to really understand what was going on. And so the primary care provider asked a behavioral health provider who is a psychology fellow placed at that site, if they could come in and see the patient. The patient agreed, and the fellow was able to really build rapport with that patient quite quickly, really see that patient, understand, take the time to ask questions. And through that interaction, the fellow learned that this particular patient was experiencing depression, he was very lonely, his grades were dropping, and he also had a plan for suicide. The fellow was able to safety plan with the patient, was able to develop a plan to get the parents on board, and also was able to see the patient until she was able to help the family. And 6 months after this all happened, the family and the patient just expressed immense gratitude for her taking the time to be there for them when it was such a challenging period of time for the patient and the family and all the fear, and she was able to be that warm support and help that patient get the help that he needed. We wouldn't have this program without the generous backing of our donors. Without that donation, we really wouldn't have been able to build the program as it is now, and now proudly we can say that we've built a program that is financially stable and sustainable, and that was through the help of our donors.